Ladies and gents, a good evening. Thank you so much for joining us from wherever you may be in the world. It's wonderful to be sitting here in England, the United Kingdom, speaking to some of my colleagues back in South Africa, in Namibia, and Scotland. So thank you so much for making the effort to be here this evening, and I hope that it is useful for us all. So today's talk, we're looking at stroke management and prevention through the use of movement. And I'm very privileged to have our guest speaker, Timothy Morris, join us this evening. I am a biokineticist, and I would just like to welcome you all to the world of biokinetics. Biokinetics is the science of human movement, and it is the clinical exercise prescription for prevention, management, rehabilitation, and treatment of injury and illness, as well as with regards to sporting performance enhancement. So biokinetics originated in South Africa. It is a 4-year BSc university degree. Some of the universities are doing a 3-year undergrad and a 1-year honors, and some of the universities are doing a 4-year course. And then for some of the courses, there is also a 1-year full internship, whereby you do a year of practical hours for experience. So before you do 5 years of medical training, you cannot yet call yourself a biokineticist. So it's a big course. Really proud to be a biokineticist, and really proud to be providing biokinetics treatments from here in England. In South Africa, the profession of biokinetics is registered as a medical profession with the Health Professionals Council of South Africa, which is the equivalent to the Healthcare Professions Council here in the UK. In South Africa, it's covered by all medical insurance companies. However, that is yet to be the case here in the UK. There's an International Biokinetics Committee, so biokinetics is making its way around the world at a rapid rate. So yeah, really exciting times for biokinetics worldwide. In the United Kingdom, we have set up the Biokinetics Association of the United Kingdom. We registered with HMRC and Companies House as of May of 2021. So we are a fresh association and just in our development stages. And if you would like to, please collect some further information about biokinetics and the biokineticists that are working in the United Kingdom, please visit our website at biokinetics.uk. So our scope of practice, we use exercise in the treatment of musculoskeletal injury, chronic disease, neurological, rheumatological, respiratory conditions, cardiac and circulatory conditions, the apparently healthy population for wellness and prevention of injury and illness, for sporting performance enhancement, and then specific population groups such as pregnant ladies, physical and mental disability, mental health, and for the older people, which is a great passion of mine. So this evening, we're going to be discussing stroke, the management and prevention of stroke. The talk is broken up into these sections, which is what is stroke, the types of stroke, who's at risk, what are the risk factors for stroke, how can we prevent it from occurring, how do we rehabilitate stroke, and then we speak with our special guest, Tim Morris, and then I've got some take-home messages for you this evening. So thank you so much for all being here. So what is stroke? A stroke occurs when the blood supply, which is oxygen-rich and nutrient-rich blood flow, is cut off from the brain. And this can happen through a variety of reasons. But unfortunately, the brain cells, due to lack of oxygen and nutrients, the brain cells become damaged and die. So unfortunately, it is a very serious condition that we are then treating. Damage to the brain can affect how your body works, how we think, and how we feel. So it affects us on all levels, our physical, cognitive, and emotional levels. And the effects of the stroke depend on where it takes place in the brain and how large the damaged area is. So if you look on the illustration, we probably all understand, but I'm going to go through all of this. The If the right side of the brain is affected, the left side of the body will be affected, and vice versa. And obviously, different areas of the brain will affect different areas of function. So there are three different types of stroke, and there is an ischemic stroke, which is caused by a blockage, which is the most common type of stroke. There's a hemorrhagic stroke, which is caused by bleeding, less common, however, does occur, and this is the one that usually occurs in younger people for various reasons. The TIA is known as the mini stroke, which is a stroke-like symptoms, but they don't last for a very long time. And it's usually a lesser degree type of stroke, but they are fairly common. And the blockage, it's because the blockage is temporary. So when we look at the ischemic stroke, there's a thrombotic stroke from within the actual vessel, like we see in this illustration. There's an embolytic stroke, which is a clot that forms somewhere else in the system and travels up to the brain. And then there's a lacunar stroke, which is a stroke that happens deep within the white tissue of the brain in the basal ganglia and the pons. So the hemorrhagic stroke is the stroke where there is bleeding into the brain tissue. And this can occur at because of a arteriovenous malfunction or an aneurysm, which is a bulge in a blood vessel, which then bursts and there is bleeding into the brain tissue. So what causes a stroke? With age, we understand that the arteries become harder and narrower, as if they are blocked. And this is that process of atherosclerosis, which we discussed in our cardiac talk, whereby cholesterol gets caught in the vessel due to all sorts of various reasons, and that builds up until it becomes a blockage within the vessel. And that obviously then will restrict blood flow. Also, medical conditions and lifestyle factors can speed up this process of atherosclerosis and increase your risk of having a stroke. So anyone can have a stroke, and this is the one of the take-home messages for this evening, is that stroke can hit anyone at any time. It is generally in the older population, but that doesn't mean that that is always the case. The younger population, as well as children, are also affected by stroke. So there's 1 in 4 strokes in the UK, actually happens to people of working age, and stroke strikes every 5 minutes in the UK. So it is a really common condition that needs our attention. So recovery from stroke is definitely possible, okay? Not with everyone, unfortunately. It is a really serious condition that can cause coma or sudden death, but we're not going to be speaking about that today. We're looking more at our stroke survivors and how we can assist through rehabilitation. So some are relatively minor, which are not lasting too long in their symptoms, and others require a lot more attention due to their severity. So that is why it is important to recognize the symptoms of stroke quickly so that we can get medical advice as well as help as quickly as possible. The quicker you receive treatment, the better your chances are for a good recovery. So the FAST test, and this is one of the next take-home messages, the FAST test is a really important tool that all of us should learn as of this evening if we don't already know it. And it gives you all of the ability to recognize the signs of whether someone is having a stroke. So FAST, FAST, the F is for facial weakness. Generally, we see a sided face droop if a stroke is occurring. There will be one-sided arm weakness. There will be speech problems, as well as T, which is now it's time to make sure you get hold of emergency personnel as quickly as possible, so that they've got the equipment to treat the patient best. Because the sooner we identify a stroke, the better our chances are of survival and better our chances are of recovery. So the risk factors for stroke, which we know some of, there are some other ones which we will focus on this evening, but there is obviously age. Generally, the older population is at greater risk. And as I said, that's not for everyone. The family history, if you have a close family member that has also had a stroke, your risk of having a stroke yourself is greater. It doesn't mean that you will have a stroke, but it is a warning sign for you to take care of your well-being to make sure that you don't. Your ethnicity, generally the Black population as well as the South Asian population are at greater risk. Medical conditions, high blood pressure, diabetes, high cholesterol, and atrial fibrillation. So high blood pressure and atrial fibrillation are the two highlighted risk factors this evening, which I'd like to discuss in more detail. Stress, as we know, living a stressful lifestyle will increase your risk of all sorts of medical conditions, which thus increases your risk of stroke. Being overweight, sickle cell disease, this is a condition whereby your red blood cell of your system is affected in carrying oxygen around the system, and that is a risk factor for stroke. Migraines with aura, so migraines that are accompanied by other sort of symptoms. And there is a slight risk associated with stroke if you have if you commonly have migraines. And then risk to women is long-term contraceptive pill use. So high blood pressure, and blood pressure is one of my more interesting topics within practice. I'm forever going on about blood pressure and how we must monitor our blood pressure, and this evening is going to be no different, but I'm just going to take a different angle at it. So what is blood pressure? Blood pressure refers to the amount of pressure that the blood, when the heart pumps, it's the amount of pressure that the blood is under when it leaves the heart. That is the systolic blood pressure, and the diastolic blood pressure is the pressure of the vessels that the blood needs to flow through, which is the diastolic pressure. And if you see here, you see that 203 over 114 is a very high blood pressure, and our ideal blood pressure at rest is 120 over 80. So 120 is the systolic, over 80 is the diastolic, at rest or lower, okay? And if we have an increased blood pressure over a prolonged length of time, the heart muscle is one that will be under strain, but also our blood vessel system. And our blood vessels into the brain will also be under pressure, putting us at greater risk of stroke. Okay, so I hope that all makes sense. Yeah, it can be quite technical, but at the same time, I've tried to make it as simple in understanding as possible. The other condition that I'd like to just mention is atrial fibrillation, and this is a cardiac condition whereby the heart muscle, the top two chambers of the heart muscle become affected by their neurological system, which causes the atria to fibrillate, so they don't quite contract the way they should. And that unfortunately causes blood to pool within the atria, okay? And if that blood were to clot, and that clot were to get through the system and up into the brain, that could be a risk for a stroke, okay? So again, not to say that if you do have atrial fibrillation, you are going to have a stroke. It's just reminding us of the risks so that we can take the adequate sort of processes to be able to take care of ourselves with regards to atrial fibrillation. For example, please do speak to our GPs, speak to our cardiologists, speak to our specialists about the medical conditions that we may be experiencing, getting the right medication to be able to manage these, as well as then changing our lifestyle with regards to diet and exercise so that we can manage ourselves the best. All right, so stroke prevention. and I was definitely on that line at the end of that slide. But stroke prevention, we're looking at our lifestyle changes and choices. We need to reduce our alcohol intake, stop smoking, stay at a healthy weight, eat healthily. And eating healthily, we might just mention like eat a balanced diet. We all sort of understand what a balanced diet might be. But at the same time, if you are at risk, I would encourage you going to see a dietitian so that you can get the correct diet for yourself to most and best take care of yourself. And be as active as you can. And this is the area that we're going to focus most of our attention on this evening as an exercise specialist and biokineticist. But that is what it's about. We need to try and be as active as possible. And it doesn't have to be intense. It just has to be moderate exercise most days of the week. Okay? Please take your prescribed medication. And this area here, regular checkups, is one of our take-home messages once more. Please do use the medical care that is at hand. Please go to a GP. Please get yourself a blood pressure monitor if you feel like you are at risk of high blood pressure, and please do monitor yourself if you feel you may be at risk, and especially if you have another health condition. So it's really important that we continue to monitor our health through our GP practices as well as by ourselves as best as we can. Great. So when we look at stroke rehabilitation and the practical considerations, we firstly look at the effects of what a stroke can cause for us, okay? And yes, this is a hugely life-changing event. The physical effects that we may experience: muscle weakness, hemiparesis, which is partial weakness of one side, hemiplegia when there is complete paralysis of one side, but they can be treated, okay? And we're going to go through the ways in which we can take care of ourselves if we are hampered by this. Okay, then drop foot. That is a condition whereby we lose the ability of our tibialis anterior muscle, so the muscle in the front of our shin, to be able to keep our toe up. And why that's so important is if we cannot keep our toe up in our walking gait, we can easily trip and fall. So there's lots of risks associated for falling after stroke, and we really need to take that closely in the front of our mind. Then tiredness and fatigue, and this is understated. Tiredness and fatigue following stroke, especially for the first couple of months, is a very important effect, which over time does get better, but it is important to recognize it. Spasticity refers to muscle contractures or muscle tightnesses that we try and work through exercises for joint range of motion. And then the patients that we see do experience changes in sensation. So it's a good one to keep in mind for the clinical brains in the audience this evening, that patients do have a change in sensation to touch, to temperature. They're unaware of their position and the movements of their limbs, and also have very strange skin sensations. So proprioception is of the paramount. All right, then on the more practical side, communication problems, changes in behavior, emotional changes, memory and thinking, and other. And we can all understand that a stroke does leave us in a very humble place, and a very lonely place, and a very isolated place. So we need to give our stroke patients as much care as possible in all areas of their life, and being understanding that these changes do occur, and those changes are often out of their control. So it's really important that we are aware of these. Great. So when we look at recovery, it's a multifactorial approach, and I think a multi-dimensional team or multidisciplinary team is really important for the best patient outcomes. So in the UK, we look at consultants, GP, physio, OT, psychologists, dietitians, speech therapists, acupuncturists, massage therapists, osteopaths. So yeah, there's a lot of recovery options. And I would just like to put on the table that the biokineticist is in the perfect place to be able to take patients through their long-term recovery, to enhance their recovery and maintain their physical well-being for the longer term. The focus areas that we're going to look at this evening is neuroplasty and secondary stroke prevention. And neuroplasty is a really interesting concept, which in this particular instance, we are trying to regain neurological innervation of muscle from brain, which I'll go through in more detail. So neuroplasticity, also known as brain plasticity, is the ability of the neural networks in the brain to change through growth and reorganization. And I'm going to give some more practical examples of this. So please do read through it if you would like to. I am going to read through these particular slides just because it is quite a complex concept, but it is actually quite amazing how our brains work. So it is when the brain is rewired to function in some way that differs from how it previously functioned. And this is a really important concept of hope for our stroke survivors. Brain has many neural pathways that we can perform function with. And these pathways are well embedded within our brains. But through repetition and intensity, we can develop new pathways to perform new tasks and improve previous ability. And that is hugely important in a stroke survivor's thinking about their own recovery. Is through repetition, through intensity, you can actually rewire your brain's ability to work, to function, and therefore to give great outcomes for your body to move in a more systematic fashion. So building up those connections makes your brain better, controlling your body, and lets you do more things that you want. So let's just take the example of riding a bike. So when we're young, this is a complete task that we have no understanding of, but through repetition and through the intense repetition of trying to ride a bike, we eventually are able to ride a bike. And that is a great example of neuroplasticity. Now, we don't ride a bike for about 20 to 30 years. And all of a sudden, there's apprehension about being able to ride a bike again if we were required to do so. And sooner or later, within possibly minutes, those neurological pathways are rewired so that we can ride a bike as we used to in our youth. And that's just an important concept of how our brains can actually rewire ourselves, whether it's to do a new task or to do a task that we've done previously. So your brain is amazing. And the aim of our rehabilitation is to, as I said, regain neurological innervation. So signals go from one cell to another, okay, and forming a connection in the brain. When a stroke kills brain cells, it damages this connection. And what's so fascinating is that the brain cells can sometimes form new connections and start sending signals again. So please, please, please tell all of our stroke patients and all of our patients of risk of brain injury, we definitely need to encourage them to understand this concept so that we can build hope, so that we can build motivation. Because as we know, stroke rehabilitation is not an easy process. Okay. Cool. So Kleiman Jones, 2008, they outlined 10 principles of neuroplasticity, and I'm just going to focus on 4, and I'm not going to go into too much more detail about them, but it's just simple concepts that are actually really powerful in understanding why we use exercise in rehabilitative settings for stroke patients. So use it or lose it. If you or I, who have not had a stroke, were to sit on the couch for 3 months, we would lose our ability to run as well as we would want to. Same concept. we've got to try and use these pathways as best as we can. Otherwise, we are at risk of losing them. Use it and improve it. That relates directly back to the stroke patient, whereby repeating the same task over and over again at a great intensity or whatever is possible will improve that neurological message. Repetition matters and intensity matters. And we do understand that it is difficult, but that is why we are with you on this journey of recovery. So I just want to take you to this forest pathway analogy. And this is well used by my colleagues, by medicine, in explaining how these pathways can be recovered. Okay, so this is actually a photo that I took in the forest nearby my home, where I go for my own runs and walks with my family. And I thought that it was apt to use that particular photo just because it's really interesting how we can find pathways through a system that actually become overgrown. And this is the concept that I'd like to leave you with this analogy, is in the brain after stroke, unfortunately, these forest pathways become overgrown. Sometimes, unfortunately, there is a big boulder in the way, and those pathways are difficult and possibly not able to be rewired. But for those pathways that can be rewired, just imagine wading yourself through a overgrown pathway within a forest. And that is what we're doing with our rehabilitation process. We are doing it one branch or one leaf at a time to try and regain our ability of those messages to get through those pathways as easily as possible to function. And I hope you enjoyed that analogy. All right. So our secondary prevention is the second area why exercise rehabilitation is so important after stroke, because the research is really strong in this area to mention that following a single stroke, your risk is extremely high for a secondary stroke, okay? Again, this does not mean that a secondary stroke is going to occur, but what this does mean for me is to encourage my patients to do more as much as possible to be able to take care of their well-being with regards to exercise, but also with regards to their eating habits, stressful lives which we are under, and also our emotional state. So the guidelines say that exercise of moderate intensity 4 to 7 times per week accumulates 150 minutes per week in episodes of 10 minutes or more, in addition to activities of daily living. So this is for the general public, as well as stroke patients. However, I feel that more intense exercise treatment, even if it is at a lower intensity, will be much greater in trying to break down those pathways and increase your neuroplasticity, which I will discuss in more detail later on in the talk. So exercise supervision with a healthcare professional is definitely advised for patients that have endured a stroke to reduce the risks of falls and injury, for monitoring purposes, because it's also really important to monitor during exercise, and for possible other medical complications. So when we look at our biokinetics treatments, initially we would do an assessment, a risk screening, and a medical clearance for exercise. The assessment gives us great information about the patient's ability, the areas of focus at which we need to pay our attention, as well as the severity of functional movement that this patient might be hampered by, okay? We then focus our treatment on fine and gross motor skills. So fine motor skills refers to using our hands better, being able to write, being able to type, being able to give someone a handshake, for example, to our gross motor skills, which are the bigger movements, such as getting up or down from a chair, which becomes really, really functional, okay? Midline training, so that we shifting the center of gravity of this particular patient, because unfortunately, after a stroke, one side of the body is affected, and that will shift the center of mass to the stronger side of that particular body, okay? So we need to try and shift the midline back to the middle of this particular patient by trying to get them to see and show them how to use the affected side, okay? Because if we can use the affected side more readily in training, we can definitely use the affected side more readily in our normal day, therefore reducing our risk of falls, okay? Range of motion, so lots of flexibility, lots of joint range of motion exercises to try and decrease spasticity. And again, I remind you of repetition and intensity to carve out those new pathways within the brain system so that we can achieve the tasks that we need to from day to day, but also so that we can achieve the tasks that we want to. So modalities of treatment, there's obviously body weight exercises or exercises using accessories such as bands or weights or things like that. But we've got to make this as specific as possible for our patients, so to improve their day-to-day function. Technology is huge in this particular area. There's functional neuromuscular electrical stimulation, there's biofeedback mechanisms, and there's assisted walking devices, which do definitely help our patients of greater severity, but also using neuromuscular stimulation can enhance the muscle activity, therefore rewiring the system a little bit better at a higher level of ability. And then we look at our cardiovascular exercise, walking, cycling, arm ergometer, so that we're definitely getting our patients taking care of their heart, circulatory systems, and the rest of their bodies whilst we focusing on muscle strengthening. And yeah, cool. Good. So our practical considerations, unfortunately, due to decreased neurological activation of muscle, joint becomes at risk of injury. So we need to prevent injury as best as possible. And I think the biokineticist is actually placed perfectly to be able to understand the complications of what a stroke is and how we rehabilitate the stroke, with also having the brain to be able to think of prevention of another injury. So stress management with my patients, I definitely encourage meditation and trying to find ways in which we can take care of our stress. I am more than happy to include other professionals in my treatment plan, because it definitely gives the best possible patient outcomes and overall treatment of that particular patient. So cognitive function, to decrease the risks of vascular dementia. Unfortunately, following a stroke, the risk of vascular dementia is increased. So cognitive function, as you will hear, is a really important area of patient treatment, to try and make sure that we are stimulating the brain in different ways to be able to achieve the same and different mental ability than before the stroke. And then there's other practical considerations such as speech difficulty swallowing and changes in sensation. The home environment, understandably, we need to make sure that the home environment is easily accessible, decrease our risk of falls, and obviously adjust the home environment as necessary per patient case. And I return myself to psychology once more, because we can have all the tools of what to do with regards to exercise, and we can encourage patients to exercise. But if there isn't a motivation, a hope of why we're doing this exercise and what we're doing this exercise for, it becomes really difficult to stick to a rehabilitation program. So we know that there are massive ups and downs with regards to stroke rehabilitation. We have fantastic leaps, then we might have a plateau and no improvement for a little while. But all I can say is just stay consistent with your exercise rehabilitation, because even though research does mention that there is time limits on your recovery, I think that there is potential for greater recovery on if you stay committed to your recovery process. So motivation and hope is the area that I work most on in my treatment of my patients. And I don't think we need to look any further than to speak with Tim Morris, our guest speaker, about motivation and hope. So Tim, welcome on call. It is an absolute privilege to have you, and thank you for your willingness to speak. Tim is an osteopath and medical herbalist with training in kinesiology. Tim, unfortunately, has undergone a stroke, and he has a wonderful story to tell. Tim is a massive inspiration to me, and not only is he a patient of my practice, but he's also a very good friend of mine. So Tim, welcome, and thank you so much for sharing your story with us.
Thank you, Simon. Well, good evening to you all. So I'd like to talk about my stroke experience. 5 years ago, I was having quite a busy life. I was running my osteopathic practice. I was also studying part-time for my degree in herbal medicine. I was particularly studying my dissertation, which was already late. And then one evening, I was typing on my computer and I noticed that my right hand kept missing some of the keys. I was falling short of the intended letter. I also had a strange sensation of pressure down my right arm and down my right leg. I checked my blood pressure and that was too high. Eventually, I realized I was having a stroke, so I went to hospital. Once there, it was confirmed that yes, I had had a stroke and it was caused by my high blood pressure. My blood pressure had been high for some time, and I was trying to treat it my own way using diet, herbs, and fasting. Now I had to accept that hadn't worked. So I took the prescribed medication, which brought my blood pressure down, and so I could leave hospital. I was very shaken by the stroke, but thankfully my symptoms were not very severe. So I pulled myself together and got on with my recovery. However, within a week, I started having severe low back pain, which was constant. I couldn't sleep. I could just rest a bit lying horizontally. I didn't know what was happening, and I didn't have any help with it. The GP kept referring me to physiotherapy, which I just felt would exacerbate the pain. Finally, I decided to go privately to get some understanding of what was happening. The consultant I saw agreed that something was definitely amiss, and we had some scans. I found out that I had got 5 fractures in my lower back, and it was caused by osteoporosis. Now, around this time, I was introduced to Simon here for some help. He was excellent, and we found some movements that would help ease the pain, and I could start recovering. I did realize that I had been given a health warning and that I needed to change my lifestyle. I did manage to finish my dissertation and qualify as a medical herbalist, but I was determined to work in a much more relaxed way and with the things that I wanted to do. I was really enjoying the exercising that Simon introduced me to, and at that time we'd become great friends. I was exercising daily, doing push-ups, pull-ups on a bar, and running around the park, feeling great with it all. And then 1 year ago, I woke up early one morning and my right arm felt odd. It felt as if I'd slept badly on it. I started moving it and rubbing it, but after 20 minutes, it still wasn't right. I got up and found that I couldn't take weight on my right leg. I was falling to the side. I checked my blood pressure and it was again too high. So I telephoned the emergency services. It wasn't until I tried to speak to them that I realized I couldn't talk properly. However, they were very good about it and sent the ambulance. So yes, it was another stroke. My walking was difficult and my right arm lacked fine motor control. So writing, typing, and texting were all difficult. I remember having got back from hospital, trying to crack an egg for breakfast once I got home. My fingers just went straight through the eggshell. So that's what fine motor control is about, using sensitive pressure to manipulate things. I had excellent National Health Service support from the start, with physiotherapist home visits, a speech therapist, occupational therapist. All were encouraging me with the same idea: just keep working with what you can't do, and it will recover. However, what I realized soon was that in a stroke, functions don't actually recover. The brain circuits which were in use were now scar tissue. However, as Simon pointed out, with neuroplasticity, the brain has amazing adaptive powers. Other parts of the brain are able to take up the signals and restructure the old movements. It's like learning to use a new instrument, and with continued repetition, the function is learned. I was aware that my body felt very strange to me, both from the inside and from the outside. It was almost as if it wasn't me anymore. What I finally realized was that the brain automatically integrates information from all sorts of inputs, the visual, the kinesthetic, the tactile, to build a living image of what my normal is. And if one of those inputs is distorted, then it can't integrate and it gets confused. So I had to work through a period of re-establishing my new normal. It took me about 9 months to feel my new normal again. I had enormous help from Simon here with my walking. He was able to find a treadmill for my home so I could work on it every day. I was doing a whole range of exercises for stretching, coordination, and balance to get my walking going. Now I'm starting to get my running going. So my message to anyone with a stroke is, firstly, have courage and patience. Work gently on what you can't manage at the moment, knowing that your body will slowly relearn the function. And also know that it's never too late to work on refunctioning. Your brain is always up for it. Thank you.
Absolutely brilliant, Tim. Thank you so much. It's a great privilege for me to hear the story from this distance as well. You know, I've walked this road with you. Yeah, just it's been a very challenging, however, extremely enjoyable walk along this road of recovery with you. And thank you for teaching me so much about what it really takes to be courageous. So Tim, thank you for sharing your story with us. And this is one of your quotes, which I will never forget. Do more of the things that are most difficult. And I will just mention that Tim and I in this photo, we went up Pitch Hill in Surrey. And for those of you that know Pitch Hill, it's not the easiest walk in the world, but I realized that Pitch Hill was an important place for Tim to get back to in his process of recovery, because Pitch Hill has been a big part of Tim's life, you know, exercising frequently. And he said to me one day, he said, "Fine, will I be able to get up Pitch Hill again?" And I was apprehensive to say yes. And I never had a doubt that we would be able to do it. I just wanted to be realistic about how long it might take to be able to get there. And when we took our little walk up Pitch Hill, which is actually quite a steep and difficult climb, I did not help Tim once. Tim walked himself up that hill courageously, and within yeah, within his capabilities. And Tim, I commend you for your extreme recovery, but I commend you more for your character. And it's an absolute privilege treating you, Tim. So thank you so much for sharing your story, and I hope that inspires all of you on call and all of you that listen to this talk, because I think that's what this world's about, is being courageous. So Tim, thank you. All right. So on that, I would just like to discuss our take-home messages. So yes, stroke is a hugely life-changing event, but with consistent effort, it can be manageable and one can gain improvement, neuroplasticity, okay? We are all at risk of stroke. We need to implement strategies and habits to reduce the risk of primary and secondary stroke. Make the choice to take care of our own well-being, both physically and mentally. Monitor frequently. So please do keep checking your health status, whether it be a heart muscle that you know you've got a history of with regards to high blood pressure, or it is your diabetes and you know you need to make sure to monitor. It may be type 2 diabetes and you haven't really taken responsibility for it over the last couple of months. Please do monitor frequently. Adhere to your doctor's orders and exercise. If you require exercise advice, please speak to a professional, because it is actually important that how exercise is administered as a medication for best possible outcomes. So there are my acknowledgements and references of tonight's talk. So yeah, I just would like to discuss our biokinetics clinic here in the UK. Myself and Gabriella Haddo are biokineticists working together in London, and we pretty much scope the whole biokinetics practice. So from musculoskeletal to chronic disease, to respiratory conditions such as COVID-19 recovery, we do scope the whole biokinetics practice. Our facilities are in Anytime Fitness in Fulham, in Soho, and we've just opened up a new facility in Liverpool Street, which we have access to as of today. So that's really exciting. We perform face-to-face consultations. We also perform one-to-one online consultations. We provide an online class called the Wellness Journey, which I absolutely love. And then at Fulham Good Neighbours, which I'll discuss in more detail on the next slide, I provide these chair-based exercise classes. So please visit our website. These associations are the associations that we are associated to, and I just must make special mention of the Biokinetics Association of the United Kingdom, because we are taking a stand within the United Kingdom. So thank you so much. Great. So Fulham Good Neighbours service, it's been a wonderful journey at Fulham Good Neighbours. I provide exercise classes both in-house and face-to-face. And Fulham Good Neighbours is a award-winning charity within Fulham that provides care for older and disabled people in the community. So if you have any questions about Fulham Good Neighbours or the services that we offer, please do get in contact, because yeah, if you are in the Fulham area, we'd be most happy to assist you. So our next talk is part 4.2 next week, Monday, and that will be taking place in-house. We will be going through stroke prevention and management once more. And Tim, thank you for joining me on that talk as well. We will be at Fulham Good Neighbours. And then the Movement is Medicine Part 5 series is the 14th and the 28th of November, where we will be discussing the management of muscle or joint injury, the aches and pains. So the 14th will be the online course, and the 28th will be the in-person presentation. So ladies and gents, thank you so much for joining, and I would be happy to answer any questions if there are any. Well done, Tom. I can see you've got your blood pressure monitor with you, so brilliant effort. Tom, you're on mute. Sorry guys, if you do want to have a comment, please do, please do unmute yourself before you might like to make a comment.
I just want to say thank you very much, and I've taken your advice.
Wonderful, Tom. I look forward to hearing the diary of blood pressure. Thank you, Tom.
Wonderful, Simon.
Great, Catherine.
Absolutely mind-boggling, to be honest. And Tim was absolutely amazing, wasn't he? He's an amazing man. Unbelievable. Yeah. Unbelievable. Yeah. There's just one question I would ask. It's probably nothing to do with that. But my husband, he's got an aneurysm in his head, you know. So if that ever went, he'd probably get a stroke as well, wouldn't he?
So yeah, let me just relay the question. So Catherine's husband has an aneurysm. What is his risk of stroke? So Catherine, I think probably going to have a stroke is the incorrect wording. I think what is important is that we continue to monitor the severity of the aneurysm, continue to listen to the doctors with regards to medication, and yeah, just live a healthy lifestyle whereby you're taking care of yourself. I think the risk is definitely there, but that doesn't mean that the outcome will be a stroke. No. I hope that helps.
It helps very much. Thank you, Simon.
Yeah, thank you. With pleasure.
Yeah, you know, really, yeah. I mean, you could listen to you both all night, you know.
Wow. Catherine, thank you. Does anyone have any other questions? Yes, Jill.
I was just a little bit curious as to what goes on in the Anytime Fitness, because that's just around the corner. What goes on in there with you? And also, well done to Tim. Thank you for sharing what you shared. It was really quite emotional. It made me a little bit teary. So thank you for that. And you, of course, Simon. But so back to my question, Anytime Fitness.
Yeah. Jill, so at Anytime Fitness, I have full biokinetics practice. We have access to a treatment room as well as a fully kitted gym, whereby I take my patients through biokinetics treatment.
Okay.
Yeah.
Thanks.
Sure.
Okay.
Of which Gabby also has access to. Gabby is new to our practice, and I'm just so grateful to have her join me in practice. So thank you. Do we have any other questions? No. Good. So are we all happy?
Very happy.
Was that educational?
Very.
Yeah. Good.
Thank you, and thank Tim.
Yeah. Thank you all for joining us. I just want to make a special mention. Avi, would you mind putting your video on if you wouldn't mind? Good evening, Avi. Please unmute yourself if you would like to. So I just want to take this opportunity to actually say thank you to Avi for taking the time to be on call this evening. Avi is the biokineticist that I did my internship under back in Cape Town, South Africa. And Avi, I just want to say thank you so much for everything we've grown as sort of colleagues within biokinetics, but also thank you for instilling me with the passion that I still have for biokinetics this many years later. So Avi, thank you so much for joining us on call.
Absolute pleasure, Simon. I'm really glad about it, and I'm glad that I was online to hear the comments from your patients, because obviously it shows that you've grown, but also nice for me is that I can still see the passion in you in taking up this challenge. So yeah, well done. And I think it was a great talk. Yeah, hopefully we'll be doing some more like this. And yeah, I'm obviously coming to visit you in December, so hopefully we'll do a talk when I'm there as well.
That's a great idea. Yeah. Avi, thank you so much for being on call, and we'll definitely catch up soon.
It's a pleasure. Thanks, mate.
Yeah, cheers. Okay, ladies and gents, so if you do have another question, we'll take one last one. Otherwise, we'll call it a night, and we've actually done really well for time. So anyone else got a question? Perfect. All right, so please have a nice evening. Please take care of yourselves. And if you need any advice with regards to exercise, you know where to find me. Please make contact, and we will definitely see you soon. So Tim, thank you so much. Gabby, thank you so much. And good evening, everyone. Thank you so much for joining us on call this evening.